Hey everyone, I'm Lauren Fleming with Hem Supportwear, and I'm here today with Ashley Castellanos. She's a dedicated practicing physical therapist who focuses on women's health and orthopedics, and she's going to talk all things pelvic health with us today, and we are so excited to have you here.
Thank you so much for having me. I'm really excited to talk about this together today.
Great. I'd like to just jump in and have you talk with us a little bit about your background and what inspired you to work in this space.
Yeah, I love that. So I got my undergrad degree from Auburn University, and then I went on and got my doctorate in physical therapy from University of St. Augustine. And I started practicing mainly in orthopedics. That's just kind of what I knew that was like my niche to start. And I built a lot on that. I really enjoyed that space, but I kept feeling like there was a missing piece that I wasn't understanding. I would have a lot of women with like chronic back pain, chronic hip pain, and I wanted to help them more, but I didn't know exactly how to get into that space with them. And so my boss actually encouraged me. I worked with five men. I was the only woman. He was like, hey, let's look at women's health, pelvic floor therapy. Let's bring it to this space. And initially, complete honesty, I was like, absolutely not. It's not for me. I like orthopedics. But he really encouraged me to go to some training, take some additional courses, see what it's like, see what I can take from it to help my orthopedic patients, and then we can go from there. So I went and did some further training under Herman and Wallace, took additional certification courses to figure out more. And as I started building on it and I was helping like my orthopedic patients and then slowly getting some people who were prenatal or postpartum who presented more so in orthopedic nature, but were also having symptoms that also correlate to the pelvic floor. I was able to utilize both my skill sets and kind of merge them together and slowly just found myself transitioning more so away from orthopedics and finding my passion really within that pelvic floor space, helping women out. I'm so grateful for my first boss who like pushed me into that space because if you would have asked me when I graduated if this is what I'd be doing, I'd be like, never know. And I love it so much. It's truly my passion. And I'm like so grateful for like the work I get to do every day with that.
Amazing. Thanks for sharing that.
Yeah.
I do think it's
Yeah.
interesting too, like how, I don't know, you can kind of like think there's this one path for you, but then the more you learn about something else, then I don't know, the more it piques your interest. And then, I don't know, it's
Exactly.
just kind of cool how things can change over time. And to have people like that in your life too that are encouraging to kind of broaden the horizon a little bit.
Yeah,
Yeah, great.
absolutely.
Can you tell us a little bit about what a typical day or week looks like for you and your work?
Yeah. So I work for an amazing company called Genesis PT and Wellness. We're based out of the DFW area. And we treat clients mainly in person, but we also do virtual appointments as well. And it's a really cool space because there's approximately 15 doctors within our company at seven different locations. My location has three of us right now. Me and the two other girls were like best friends. We all get along. So the day to day is really fun. I see typically five to eight patients a day. So it's not overwhelming. We are very strict on one care. You stick with the same provider the entire time, which is really nice. And we allow time in between each patient to like reset, take in what we've learned from that case and like kind of document all of that stuff. So I love like my day-to-day operations. I start at 7, which is nice. I'm more of an early person, get my day
Mhm.
going, work till 5, 5 to 8 patients, and then I get my Fridays off and get the weekend, which is nice. So it's a good reset to start again. And so I see like during a week, I probably see approximately new patient wise, I probably see 4 to 6 new patients a week.
Okay.
Currently, we're having a really big influx, which is amazing. I feel like there is a baby boom happening. I don't know what is
Mhm.
happening, but I feel like everyone and their mother is pregnant right now. So lots of new patients are coming in right now. So our evaluations run about an hour and a half, which is nice.
Mm.
So we really have that time to like dive in and get to the nitty gritty. We go through like medical history, we go through orthopedic concerns, we go through pelvic floor history, like our bowel, our bladder, our sexual history, all the things that like sometimes I feel like when we go into like a space, we like get asked like a few quick questions and like, okay, what's your concerns? Let's get out here,
Yeah.
let's go. And it's
Yep.
really nice in this space that we have the time to sit down, get to know the individual because each person we treat is an individual, they're a person.
Mhm.
And so we're able to prioritize and make each treatment session specific to each person, which I love.
Right.
So,
Yeah.
and then our treatment sessions are about an hour. they're very, for me at least, they're very hands-on manual based. I would say about 40 to 50 minutes. I am just hands-on doing a lot of treatment stuff, whether that could be like dry needling, it could be soft tissue work, cupping, joint mobilizations, internal release, things like that.
Mhm.
And then we go down to the gym. I give you some stuff to start doing at home to carry over and maintain the things that we worked on within our
Mhm.
treatment session that time. So it definitely
Great.
varies from patient to patient, which makes
Of
it
course.
nice, keeps the day very interesting. You never know what
Yes,
you're going to
right,
get. So,
right.
yeah,
Yeah, where
I
it's like
love it.
seemingly you're doing the same thing every day, but that's absolutely not the case at all.
Exactly, exactly.
Yeah. Well, and I love what you talked about too. I think it's so helpful to like kind of pull the curtain back a bit and hear what it's like from your perspective because I think especially if people who are new to pelvic floor physical therapy or working with someone like yourself, like I think a lot of our experience in the healthcare world is those very quick visits, kind of like you said, where there's just like a few minutes, you kind of get to talk about some stuff high level, but you really don't get that one-on-one, what ends up being this like longer term relationship with people and having that space to really like have like let you as a patient walk through everything and then feel very seen and heard. I think it goes such a long way for folks who are looking for care and people who
Yeah.
aren't familiar with this space. I think it can be a really powerful tool. And I think even just getting to hear about it is really helpful to be like, hey, is this a good fit for me? Um,
Yeah.
yeah, and just kind of destigmatizing a little bit and demystifying it a little bit, I think is great.
Exactly. Exactly. I feel like some medical providers can get a really bad rap because they're like, well, they didn't take the time to get to know me. And
Yeah.
honestly, especially with insurance-based practices, sometimes they don't have the time. And it's not because they don't care and they don't want to. They're trying to meet metrics that they have to meet based
Yeah.
on what the company is saying. And for us, we don't really have metrics that we have to meet. And we are actually not insurance-based. We are cash pay, which can be a little bit unattainable at times, and we're aware of that. But what that allows us to do is to take that time.
Yeah.
And we also have like 15-minute like free consults. And so I always encourage people like, hey, if you don't know if this is for you, hop
Hmm.
on a consult for free. Ask the questions that you want to ask. We're not going to
Hmm.
lie to you and be like, yeah, we can help you if it's not within our
Right.
scope. We're going to point you in the right
Yeah.
direction. But I think there's so much unknown about what pelvic floor therapy is. And it's such an interesting and small niche right now that like there's a lot of apprehension around starting it or like doing
Yes.
it. And so having that consult be like, get that reassurance, like, hey, you're in the right spot.
Yeah.
We can help you. Like, you're not the only one who like struggles with this stuff. I think
Hmm.
that's really great for patients as well.
Yeah, I think that that's huge. It's kind of a great segue into another thing I was thinking about, which is how do you explain the importance of pelvic health to somebody who's either has very minimal knowledge or may have not
Mhm.
even heard about it before?
Yeah, for sure. I feel like again, the pelvic floor itself is such like a small niche that no one thinks about. Like day to day, we're probably not sitting there like, how's my pelvic floor doing? But like if we have like shoulder pain, we're like, "Oh, okay, let's think about my shoulder
Yeah.
sometimes, things like that. Because it's something that we don't see daily, it's not something that we think about daily until we start having dysfunction and we're like, is this normal? Is this not? I think there's also a lot of stigma of like, let's talk about like pregnancy or postpartum. They're like, oh, everyone pees after they have a baby. That's just like so normal.
Right.
Everyone does it. And we're like, hey, like it might be common. And we had maybe neutralized and be like, yeah, everyone does it, but it's not normal. That's actually a sign
Yeah.
of dysfunction that our body is not managing pressure well. So what I like to do when I talk to people about the pelvic floor is like one, I think I'm a very visual learner. My brain likes to see puzzle pieces put together. So I like to start by like saying, like, hey, this is what your pelvic floor is. Like one, everyone has a pelvic floor, not just women, men do too. Everyone has a pelvic floor. And when it's not working appropriately, or when there's like a puzzle piece that is not meshing with the rest of the puzzle, we can have dysfunction. And this is what dysfunction can look like. And if
Hmm.
you have these symptoms, most likely we're having some biomechanical dysfunction within our body. Now, is that in our pelvic floor? Potentially. Sometimes pelvic floor symptoms are present, but the pelvic floor itself is fine, but our diaphragm is restricted, or our pelvis is not and is sitting in a good position, or our ankles aren't moving well and we're running and we're leaking a lot because our ankle's not able to absorb the load. So like recognizing that like, hey, your body works so holistically and like
Hmm.
kind of zooming out, but also taking it apart a little bit. I think when people understand how their body works, they're more available or like interested in correcting it, I guess.
Yeah, right, right. And really taking that whole body approach of like, okay,
Mhm.
this thing could be, I could have a number of contributing factors to this. And once you kind of start peeling that onion, you're like, oh, this is a complicated
Yeah.
system
I'll
here.
like work on someone's ankle and they're like, "What are you doing?" And I'm like, "Well, you're leaking while you're running and your ankle's not moving." And I'll fix their ankle and get the mobility a little bit better. And they come back next time, they're like, "That's so weird, but it worked." And I'm like,
Right,
and sometimes I'm like, I know it's weird. I'm fully aware that
right,
what we just did doesn't make sense, but it shows that it works. So we're gonna keep on doing it, and that's
right,
okay.
right, right. Go take what works.
Yeah, exactly. We don't ask questions, we just do it.
Right. Uh, um, Another thing, that I feel like I see a lot is people don't come to someone like you until they have a problem. It's often very reactive. Will you talk a little bit about how and why we should
Yeah.
think about pelvic floor physical therapy in a proactive sense?
Yeah. I think the US healthcare is a very corrective healthcare. We go
Yeah.
to the doctors when something is wrong and we want to fix it, right? And so, what my passion and my vision could be moving forward is I want to move to like more of a preventative health care society. Because think about it, you don't take your car to get gas once it's run out on the side of the road and it's no longer moving, right? You realize, like, hey, we're starting to get a little bit low. Let's go fill our car back up. Same with our body. Why are we waiting until something is fully wrong with it? And most of the times we like notice, like, okay, my like shoulder's starting to twinge a little bit, but we let it go. We sleep it off. We take
Mhm.
some Tylenol, a leave, we ice, heat, maybe do a little stretching and we just continue prolonging it and becomes into like a chronic cycle and our bodies work on
Mhm.
like these neural pathways and they pick up on that on us waiting and they can heighten our experience with that and so why are we waiting until there's a huge problem to fix it, right?
Yeah.
And so one big thing that I love doing is we do prenatal packages at our practice and I tell my girls, I'm like, hey, don't wait until there's an issue.
Yeah.
Once we're pregnant and we know we're pregnant and we're moving and we're getting out of that first trimester slump, because I know that first
Yeah.
trimester is just
Mhm.
tough for most of our girls. Once we're out of that slump, come in, let's do an evaluation, let's get a baseline measurement, and then let's work together through this entire pregnancy to just be the best version of ourselves so that one, when we get to our labor and delivery, we know how to appropriately deliver a baby,
Yeah.
or we are prepared for a C-section if that's what we're moving into. And then two, we know what to do in that immediate postpartum recovery. We're not delivering a baby and then in that hospital bed, like my body hurts. I don't know what to do. I don't know who to go
Right.
to. And then three, we can just continue healing on after. And then we have our baseline from where we started and kind of know what we want to get back to.
Mhm.
Um, and the same thing for postpartum. I tell my girls, like, if once you have your baby, beautiful. You guys are both healing. At 6 weeks, I want you to come in regardless if you think you have symptoms.
Yeah.
And a lot of times I'll have girls come in, we'll do an evaluation. I'm like, hey, everything looks amazing. Here's what I want you to keep doing. And then I'm here if you
Mhm.
need me in the future. And what
Yeah.
that does is like allows us to make sure everything's healing well. Because sometimes there's like silent symptoms that we're not going to see.
Yeah.
And then they can just progress over time. And then it gets to the point where like, my tailbone hurts so, so, so bad. I'm like, when did it start? They're
Mhm.
like, well, when I left the hospital. I'm like, your baby's a year old. Like, so we've
Right.
been dealing with this, but we've just let it
Yeah.
get to a point where it's so painful. Let's be more preventative. And so we can work on things early on so they don't get so heightened in our systems.
Mhm. Yeah, I really love that because I feel like the more it can just be the standard of care, and it's like this is just
Mhm.
expected that
Mhm.
you are having this as a resource. I think it does so many things. I know I was fortunate enough that a pelvic floor PT had come and done a talk at a prenatal event that I was at, and so I had actually gotten kind of her expectant parent package, and I was so thankful
Mhm.
for it because I ended up having prolapse after my first. And I was still
Yeah,
blindsided by it, even though I had some of these resources in place. And thankfully, I was able to quickly get to her. I cannot
Mhm.
imagine what it would have been like, because that was hard enough. That experience,
Yeah.
even having the resources, was really hard.
Yeah.
I can't
Mhm.
imagine what it would have been like had I not known of pelvic floor PT or not had that relationship already established where it was like, okay, well, I'm going in at 6 weeks and I can talk to her about this then. Like, it was so
Exactly.
powerful. Yeah. And I think the other thing too, to kind of the point you made of even if there's not, something and you can just say, hey, yeah, keep doing these things. I think anytime you can have those doors open so that when something comes up, it just reduces that barrier of, okay, well, who is my provider and who do I see?
Yeah.
And, that whole thing, there's such like that mental load that goes along with that too. I think the more you can have those relationships established, you're like, oh, this came up. I'm going to go talk to Ashley about it. And, we can just kind of keep going. Like it's so, so nice.
Yeah, that's exactly what you said. I think like being established with a person is
Hmm.
so helpful. So the sooner you start, the sooner you're established. And like I said, we're very busy right now. So I always tell my girls, I'm like, hey, I'm not like seeking out a ton of new patients right now.
Yeah.
So I'm not going to keep you guys around for a lifetime. My goal is always a discharge for my patients. And I
Yeah.
tell them that day when I'm like, hey, I don't want you to be here forever. I want you to manage this yourself. I want to give you
Yeah.
the tools and treat you in the beginning. And then later, if anything ever comes back, or we get pregnant again, or we have a surgery, I'm here again for you.
Yeah.
And then we'll start back up from there. And
Yeah.
I think people really appreciate that as well.
Right, because I know some concerns too can be like, oh, well, if I start this, I'll never get to stop. And I mean,
Yes.
there's that fear as well. So I think
Yes.
hearing that from the beginning can feel very helpful. And another thing, I've heard some providers talk about, and I kind of take this approach myself, is also kind of considering it as an annual check-in. Like if I've got my OB-GYN
Yes.
check-in, then I schedule my pelvic floor PT check-in at the same time, regardless of how my body is feeling, because I personally have a condition that I work to manage, but then also our bodies change. And so it's like where you were a year ago isn't where you are today. And I think that can be a helpful approach too if you have the resources and means, to take that approach.
Exactly. And I think I like what you said. Like we work so closely with OB-GYNs, but we do such different things. And I
Yes.
don't think people recognize that sometimes. They're like, well, I go to my OB-GYN every year.
Yep.
I'm like, that is beautiful. I
Yeah.
want you to go get your pap smear. I
Right.
want you to go get everything like screened because
Yep. Keep it
I'm not
up.
going to run those tests for you. But what they aren't doing is they're not checking the tone of your pelvic floor, the
Hmm.
coordination, the strength, the quality of your pelvic floor.
Yeah.
They're not assessing your pelvic alignment and where you're at. And so why not add it? And again, one day, my goal, my vision, my hope is that this is standard practice for all
Yeah.
women across the board and men too. But let's start with women. We got
Right.
a
Right.
little more that we got to get going.
Yeah.
Because it is standard practice in other countries. We just our healthcare and our society hasn't caught up to that.
Right.
And so until then, we just keep talking about it. And I think that's the biggest thing
Mhm.
that we can do. And I love that you host these interviews and you talk about this stuff because again, I think prolapse is a huge one that like it's either one, very scary to patients to hear about that, or two, some girls have no clue what it is. They have
Right.
no awareness of what a prolapse is. And I'm like, hey, like
Yeah.
you have a prolapse, and that's okay. They come in like there's so much pressure down there, and they'll be like 7 weeks postpartum. I'm like, okay, did your OB check after? And they're like, no, they didn't check, but I told them there was pressure, so they said to come to you. I'm like, beautiful that they sent you to me.
Yeah.
And we check, and I'm like, do you know what a prolapse is? And there's such lack of education
Yeah.
surrounding women's health. And so I think the more we talk about it, the less taboo we make it because it can be like
Hmm.
very sensitive. I know it's very intimate. And if you would have asked me again when I graduated school, if I was be talking about sex and all this stuff, I'd be like,
Right.
no, 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 no. But now I see like the more we remove the just like the taboo around it, the
Yeah.
better it is because like we're struggling with it. We're dealing with a lot of these
Right.
symptoms and people are insecure about it and they're hiding it and they're just dealing with
Yeah.
it internally and it's bleeding into other parts of their life
Right.
unknowingly.
Yeah, absolutely. Yeah, it's such a mental, I mean, it's like when you aren't doing well physically, it permeates
Hmm.
everything.
Hmm.
So yeah, I think definitely the destigmatizing it, talking about it. Yeah, it is interesting, like as you shift into this space because you definitely have different, and I imagine you and your work, you have very different conversations with people now, like once they kind of know what you do. I mean, outside of
Yes.
your work,
Yes.
right? I mean, I always think too of like we have a good friend that's a physical therapist, kind of
Uh-huh.
more general sports recovery and stuff. He's like, yeah, I'm constantly getting like texts and phone calls of just like, this thing happened to me. Can you tell
Yes.
me about it? Right?
It's so funny. The girls' dinners, when I go with my girls for girls' dinners, the conversations, they'll be like Auburn natural conversation. They'll be like, so I have a question. And I'm like, let's start
Here we
this.
go.
And it's like fired off one at the other. And like now my mom will text me and she's like, so and so has a UTI. I'm like, great. Probably need antibiotics, but also let's start taking a D-mannose supplement. Like, but I can't help you over the phone with that, mom. But she wants to help everyone, so she's
Of
my
course.
little
Yep.
lifeline for
And
that,
she's like,
which we
my
love.
daughter can help with this.
Exactly. Every time she's like, oh, my daughter does that. My daughter works at women's health. She will help you. And I'm like, I can't help an antibiotic over the phone.
Right.
So can't help you there.
Oh, it's the
So
enthusiasm
funny.
and the passion from her
I
that's
love the
important, right?
support. I love the support. She's a very proud mother and we love her
Oh,
dearly.
so sweet. That's great. Oh man. Um, can you talk a little bit about, so I mean, definitely directly leading from this conversation of like, there's a lot of like lack of knowledge here. I
Mhm.
think there's also quite a few misconceptions in this space.
Yeah.
Will you talk a little bit about, some of the biggest ones you see or the ones, that maybe get under your skin the most?
Yeah. I think just like the main one is that pelvic floor. Okay, this is the one that gets under my skin the most. Is when someone wants to come to me for prenatal and then someone might advise them that you don't need that till postpartum. You don't need that. And
Yeah.
then they stop coming because they were told by
Yeah.
another medical provider, you don't need that till postpartum. That is probably one of the biggest misconceptions, which we've already touched on earlier, like why the need for preventative or even just like
It's
maintenance
huge.
through the pregnancy as our bodies
Hmm.
are significantly changing in those 9, 10 months, right? So I think that is a big misconception. I think men don't understand that they have pelvic floors.
Right.
I think that's a huge
I
misconception.
just
They'll be
think
like, oh, that's for girls. And I'm like,
woman's issue.
well, yeah, I'm like, well, I only treat women. However, our practice, they do treat men.
Right.
Personally, hands off for me. But I'm like, y'all do have pelvic floors. Y'all do
Right.
have pelvic floor dysfunctions. It's just a lack of understanding of our bodies is a huge one.
Yes.
And then I think the other misconception is just like the commonality of your symptoms. Like, oh, that happens. That's supposed to
Yeah.
happen. It's like, no, it doesn't have to happen. You don't
Yeah.
have to pee your pants. You don't have to live with this pressure constantly. You don't have to live with this fear of like your organs just randomly falling out when you're doing
Right.
something. And so there's a lot of fear mongering around things like that. And so I think that's what gets under my skin is when people are like, oh, you can't do this because you're pregnant. Oh, you
Yeah.
can't do this because you have a prolapse. It's like, well, why can't someone with a prolapse do a squat?
Right.
They definitely can do a squat. We just need to see how they're doing the squat. Are they managing their pressure well? When they do the squat, are they applying too much pressure down that it is putting too much pressure on their
Hmm.
organ that is causing like more symptoms? However, if that's the case, they're not doing a squat properly. So let's
Right.
remove fear from a lot of movement. I think that's a huge thing. Like my pregnant girl's like, I can't do any
Yeah.
core workout because I'm pregnant. I'm like, you need to do core workouts
Right.
because you're
Yeah. Not
pregnant.
only
We
can
need
you, should
that.
you should.
Exactly. And then Kegels, those are no longer a thing. We got to get those out of there. I think we see a lot of people, and everyone means well. No one is purposely giving misinformation, but we see a lot of misinformation surrounding
Yeah.
Kegels or like proper pelvic floor workouts by like influencers or
Yeah.
people online who have potentially had symptoms themselves and it's gone better, but like what they are actually providing is misinformation and is making people
Right.
worse. And so I think that is a huge like one misconception I wish I could take away is like Kegels are not going to solve your problems. People online don't know everything. Instagram
Right.
is a lie. So you see someone postpartum 2 weeks running on the
Oh,
treadmill. That's really bad, but also it's
yep.
like that's not real. So let's remove
Right.
that. Let's stop comparing. Let's get you into the clinic. Let's see how
Right.
you are doing, and then let's
Because
go from
that's the
there.
key, right? I mean, I think that's the other huge part when people see a lot of that stuff online is they think,
Hmm.
oh, I'm leaking or I'm this or I'm that.
Hmm.
So I need Kegels. I need a strong pelvic floor. I need all
Hmm.
those things. And it's like, sure, you do need a strong
You
pelvic
do,
floor, but
yeah.
can you relax it? Or do you have a tension issue? And that's where I feel like
Yes.
there's this huge gap in knowledge is it's like if I have this,
Yes.
it means I need to do this. And to what you said at the beginning is it is such an individualized practice and it's
Hmm.
this body is this whole system and without that knowledge of like do you have tensity do you have laxity like
Yeah,
what is going on like then you don't know which one you should kind of be like self prescribing
exactly.
and working on and
Exactly. And I
so
would say
hard to make it
90%,
worse.
exactly. And I would say 90% of my girls, 90% probably have a hypertonic, so overactive pelvic floor
Yep.
that they can't relax. And I'm
Hmm.
like, hey, you've been doing Kegels for 6 months because you found a program. And like,
Right.
I get they're trying to find an option that they can self-resolve, which I love that they're
Right.
taking that
Right.
step forward. So I'm like, do it. However, seek a professional advice first and
Yep.
someone that is specific to you
Hmm.
because everyone is very different.
Right.
A
Because
lot
then
of
you can
times,
kind
it's,
of guide them with the programs to look
yeah,
for. That's the part that I think is
exactly.
so great. It's not that, oh, all these online programs are bad.
No,
It's
no,
like
there's
know
great
what
ones.
they're working on and then know
Hmm.
if that's the right fit for you.
Exactly,
And yeah,
exactly. I love that.
yeah, yeah, it's such a huge part. Cool.
Yeah.
Will you tell us, could you share a success story about, yeah, just something you kind of come across in your work that's really like resonated or people would
Yeah.
enjoy hearing about?
Have I have some good ones actually. I'm trying to think.
Probably hard to narrow it down.
I know I have some really good ones. It's so I work in like I love my prenatal postpartum girls. That is probably like one of my top passions. But I also work with trauma survivors, and that's another big passion of mine.
Mhm,
And so I think sometimes like that one has a lot of different components to it for sure.
mhm.
And like, so getting involved with like mental therapists and co-collaborating with like other
Yeah.
professionals has been a big one. And then I had a woman who got married. Intimacy, which she waited till marriage for intimacy. Intimacy was completely fine at first. Unfortunately, she was a victim of abuse on the side and was a survivor. And so when she came to find me, she had not had sex with her husband for 7 years because it was too painful. She has a diagnosis called dyspareunia vaginismus. Um, and so she wasn't able to have sex with her husband for 7 years. And it was not an overnight fix because there was a lot of walls to build down.
Mhm,
But after seeing her for like one of my longer patients for 7 months, she's now
mhm,
pain-free intimacy with her husband whenever she wants. Her barriers are broken down. Her body responds to that space in a safe way now versus
mhm.
being a trauma informed response
Reaction. Yeah.
or trauma reaction response. And so her
Mhm.
body knows like, hey, she is safe again. And her marriage was basically, she said, like, you saved my marriage. And I think
Yeah.
being in that space to like allow marriages to heal and
Yeah.
help that or help families bring new life and like fill and heal a family with that. That is just probably what gives me the most amount of satisfaction and like what I
Mhm.
like thrive on as well. So that's probably like my one of my
Absolutely.
favorite ones. Yeah.
Yeah, no, that's huge. I thank you so much for sharing that because I think
Yeah.
hearing stories like that are so impactful for so many reasons,
Mhm.
especially in the sense that if you have I feel like sometimes people feel like I've had this forever, I can't fix it. And in that
Mhm.
story, I think it's so impactful to hear she's had this for a long time and was able to overcome it and really like
Mhm.
achieve the things that she wants to. And so
Yeah.
I think I mean I would just hope that people who hear this who may feel like golly there's no hope for me or this I've been
Mhm.
doing this forever, I can't change things like to just know that there's people out there who want to help you and that there's tools and it's like it's not a one size fits
Yes.
all and you can take this
Yes.
very holistic collaborative approach
Yeah.
and find what works for you and I think it's just thanks for sharing because I think it's very very
Yeah.
impactful.
Yeah. I always think like Al girls gonna be like, I probably came in too late to start this. I'm like,
Right. Yeah,
it just
right.
might take more time, but
Yep.
as long as you're okay with investing your time,
Mhm.
would love to help you. And usually they're like, I want it. And so we do it. And it's really cool to see like the progress over time. And I think, as I think, it's not, pelvic floor therapy is not an overnight fix. And I always
Right.
tell my people that, like,
Yeah.
I'm not magical. I'm not going to snap my fingers and you get better. I'm not going to touch one spot and everything is healed.
Right.
But if you trust me and you do your part, you're going to feel a lot better. And
Yeah.
usually that helps and everyone like buys in and it's really cool to see the progress over time. And then they're
Yeah.
great. And then we discharge and then that's sad because I don't see them again until like the next season. So
Right. Yeah. Great.
yeah.
Well, as we wrap up, is there any final thoughts or anything you want to like kind of you wish everybody knew or that you'd want to leave us with as we wrap up?
No, I just think I'm so grateful for you again for you having me on this interview today. Just to get the word out more about pelvic therapy. And I would just encourage the women or men or anyone listening to this, like if this resonates with you and you feel like, hey, like I have symptoms that like been dealing for so long or like really new and like I finally want to take the next step to like work on this, find a provider, find someone in your area.
Yeah.
If you can't find someone in your area, reach out. I don't know if you're gonna like drop my
I
Instagram
will, we'll
handle.
have links. Yeah, we'll have links.
Drop my Instagram
Contact
handle,
info. Reach
DM
out.
me. It's yeah, it's not gonna bother me. We do virtual visits and I can help you out when we can find you someone in your space, but don't just keep sitting in it internally. Like,
Yeah.
take the next step because it's so worth it. We have one body that we're given during this life. So take care of it. Let's heal it. Let's have the best life. But that would be like my main encouragement. And Lauren, I'm like so excited for all the work that you're doing, like within this field as well. And like I just got my my package in, so I'm really excited
Oh,
to like go
great.
through it and
Yes.
stuff. So I'm really like grateful for
Right.
you and the work that you've done for this community as well. So I really appreciate
Yeah,
that.
thank you. Yeah,
Yeah.
it's it's a path I never thought I would be on, kind of similar to yours where it
Yeah.
wasn't in your radar and then things happen and
Mhm.
I'm excited to get to connect with people like yourself and one of my favorite things about this community is how supportive it is and how really the goal is to help people feel better. And so I just think that people who are looking for help, if they know that really that it's such a mission driven space,
Mhm. Mhm.
I think that they'll find a really good community here. So thank you so much, Ashley. I really appreciate your
Thank you.
time today.
I appreciate you.